enough about celebrities.
Yeah,
Let's talk about a pretty crazy topic. This one's it's interesting and it's important to know. And we've kind of at various times talked about this, maybe not its own segment. So this is a segment about specific breast implants that can give you cancer.
Yeah, I've kind of faintly remember.
Yeah, we talked about this at one point, but not like as its own segment. I think it was like part of a different segment. I do think this is good for people to know because there is some risk associated with this. So, and I have people ask me all the time, do breast implants increase your risk of cancer? And the general answer is no, except for one specific type.
Like a brand?
It's not a brand, it's a type.
Oh.
Yeah. Okay, so and this segment comes from a recent surgery I did where I actually opened somebody up to swap out their implants. And so this patient came in, she had implants put in like the mid-2000s. And so they were, a little over 15 years old, and they were too big. She didn't want them that big anymore, and she'd had some sagging. So she wanted to swap out her implants for smaller ones and do a lift, which is a really common operation I do all the time. And she did have some scarring in her implants. Like her implants felt a little hard, which ideally, they shouldn't feel hard. That's a complication. That's called capsular contracture, and you shouldn't have that. But she had some capsular contracture, so we're going to fix that, put in smaller implants, and do a lift. So when I opened her up, I found something unusual, which is this specific implant type that has been found to potentially cause cancer. And at the end here, we'll talk about that particular cancer. So I took some video, and I want to show the video. And I'm going to, Travis, if we can, when you roll this video, hopefully you guys still hear me. So the implants are the ones on the bottom. Yeah. So these are textured implants. So look, I'm going to pick it up, and you can see this thing has texture. And the best way to describe it, it's almost like a stucco wall. Like it's rough and bumpy. Like it has like a real kind of grain to it that you can feel.
Yeah.
And that's really very different to kind of the industry standard implants, which are the ones above. And the ones above are not actually the implants we put in. These are sizers. So this is what I put in to kind of judge what permanent implant I'm going to use. Okay. So you notice that shell on there is much smoother, right? Yeah. It's very smooth. There's no kind of texture to it whatsoever. And those are industry standard, the ones on the top. Those are smooth, round, silicone gel implants. And so, the next question would be like, well, why do people use the textured implants at all? So when you went to get your consult, and I know you've been open about this, so if you're new to the show, I'm not putting Sarah on the spot here. Did they talk to you about the different types of implants when you went to do your surgery or no?
All I remember is just saline versus silicone.
Oh, wait, saline versus silicone, which is kind of the big one, right? Saline versus silicone, which, by the way, if you want to answer that question, it is silicone. Is the right answer. But yeah, there's also different types of implants beyond that. And so in the 2000s, shaped implants became a thing. So shaped implants are not round. They have a end or a side that's bigger. It's shaped like a teardrop, like this. There we go. So round implants are kind of like this, and then teardrops are like that. Round implants, though, do become teardrops with gravity, so they actually do the same thing as shaped. So in the mid-2000s, these shaped implants came out on the market, and one problem with the shaped implant is if it rotates...
It looks weird.
It looks weird. Yeah. So textured implants kind of got a little bit of resurgence there because one of the things that textured implants do is they adhere to the tissues on the inside, and the thought is well, if they adhere, then the implant's less likely to rotate. Also, they're less likely to flip over, which is a very rare thing. I mean, I've seen that every now and then, but it's not very common. Some people think that has less risk of bottoming out, which is where the implant, goes below the breast. Now, I really disagree with pretty much everything that these reasons were stated for using textured implants. First off, I hate shaped implants. I was actually in the study that was the big FDA trial because my boss at the time was one of the lead investigators in it. And after we had used some of these shaped implants, I was like, I'm never using these things. Rotation was a problem. Like we were having to go back to surgery to rotate people's implants, which is not good.
Right.
So I was against those. I also am against these textured implants because I believe that they are more prone to cause scarring. Now, some people say they think that they're actually less likely to cause scarring, which I think is kind of nonsense because, I mean, this patient's a a classic example. When I opened her up, like that implant was just stuck to the inside. I mean, that causes a reaction.
Sounds gross.
It causes a reaction to the tissues, and I think that reaction is making you more likely to have
So
scarring.
do they still have these on the market, even though
I
they
think
have an
technically
increase?
they do. So nowadays, I think smooth is like 97 or 98% of implants used. I think there are still some holdouts out there using shaped implants, and so I think that's why some people are still using textured implants. I never like textured implants. I just think that they are prone to problems, not benefits. So I was always kind of against using them. And then what ended up happening is then in the early teens, so like, I don't know, 2012-ish, and I'm not sure that's the exact years, don't hold me that, but it was roughly 10 to 15 years ago. It was discovered that patients who had textured implants in were coming down with a very, very specific rare type of breast cancer, which is anaplastic large cell lymphoma. So it's not the same breast cancer that like ductal or lobular cancer that people get when you hear the classic thing of breast cancer. And so I actually diagnosed one of these, which is really wild. So it was a patient that came into an ER and she had implants, and then suddenly, not suddenly, but over a short period of time, like her breast really swelled up. She came into an ER, and I was consulted because I was the doctor on call. And I took her to the OR, opened her up, thought maybe she had an infection, and there was a bunch of fluid around her implant, and there was this weird, really weird, like, kind of tissue-y stuff on her capsule. And I was like, this is bizarre. I've never seen anything like this. So I did the right thing, which is to send some of it off to pathology. And then I took out her implant and washed everything out. And it came back as cancer.
Yeah.
It came back as anaplastic large cell lymphoma. And at the time, I didn't know about this. Like, it wasn't really a known thing. In fact, her pathology got sent to UT Southwestern because the findings were unexpected and so rare. And UT Southwestern, which is like a huge cancer center, called me and said, hey, by any chance, did you take a picture of what this looked like in surgery? And I was like, no, unfortunately, I didn't, because I thought it was clot or some sort of like, a granulation growth or something.
Yeah, you're just doing like due diligence.
I was
like,
just doing due diligence. I mean, it was
Yeah.
weird. And I'm thankful I sent some off, which is the right thing to do. But I had no idea it was cancer. Like, no clue, because this ALCL was not a known thing at the time. And so, yeah, I actually diagnosed one of these cases early on, which is really kind of cool because this is very rare. So, the next question comes up. It's like, okay, if I have these textured implants, what are my chances of getting the cancer? And there's a couple studies out there on that. They say the risk is somewhere between 1 in 5,000 and 1 in like 85,000.
Yeah.
So realistically, if you have these implants, you're not going to get cancer.
But like, why would you pick them if there's a chance?
Right, exactly right. Yes.
Yeah.
And not to mention the other issues. So
Yeah.
So, I mean, and I'll tell you, the other thing about ALCL, and they call this BIA, so it's breast implant associated ALCL, which is anaplastic large cell lymphoma. If you get this cancer, it is got a very, very, very good prognosis. The cure rate's very high. The 5-year survival rates is over 90%, which is very, very high for cancers.
Yeah.
So it's not like this is a terrible cancer, but I'm telling you, if you know someone or if you have textured implants, I would get them out. Because why? Why take the risk?
Yeah.
And I honestly don't think these things should be on the market anymore, personally. I just don't think there's any benefits. I mean, I've used these things in the
Sounds silly
past.
to get.
Yeah, right? It's like, why get something that gives you added risk if there's no benefit? And I just don't think there's benefit. I mean, I have used these. I used them because I was in the study for the CPG implants, which were textured shape implants. I don't like them.
So if a doctor is like, oh, we have these textured implants, red flag, get out of there.
I would, because I mean, I would ask that person to be like, why are you using these?
Yeah.
Like, what benefit do you see in using these? I mean, I don't know. I just don't think there's a benefit. I think all the advantages they say are just kind of bogus.
Right.
Honestly. So yeah, like if you know somebody that has textured implants, or if you have textured implants, I don't think it's an emergency. You don't gotta like rush out, and go get those things taken out. But I would plan in the very near future getting them out.
Yeah.
That's
It's
just
scary.
why take the risk of getting cancer? Like, I mean, I don't get it.